This video is the fourth in the series of 5 videos on inflammatory bowel disease and will discuss the drugs mesalamine and steroids. Mesalamine or 5-amino-salicylic acid or 5-ASA in the form of enemas, foam or suppositories or tablets are used in inflammatory bowel disease. These drugs reduce inflammation. Mesalamine slow release includes Pentasa, Celofoc and Asacol and is indicated for disease of the end of the small intestine or ileum and right side of the colon. The drug is contained in a tablet and the mesalamine is released slowly when it reaches the end of the small intestine and beginning of the large intestine. Pentasa and Celofoc are better than Asacol as more 5-ASA is released into the intestine. Oral mesalamine is best given once a day rather than splitting the dose to 2 or 3 times a day. Balasalazide is a mesalamine that is activated by gut bacteria in the colon. Gut bacteria activate the drug, releasing mesalamine in the colon, and it is ideal as treatment for inflammatory bowel disease affecting the colon. Sulfasalazine is a combination of 5-ASA and sulfur. Bacteria in the colon is needed to break down this drug to activate 5-ASA. Sulfasalazine has more side effects than mesalamine because of its sulfur component. Enemas are administered at bedtime and patients are encouraged to retain the enema through the night. Stay lying on the left side or on your tummy for 20 to 30 minutes to give the enema time to work. After this time, you can go to the toilet to release the remaining liquid or foam. About 30 minutes of direct contact of the drug onto the lining of the intestine is sufficient for it to be effective. Rectal mesalamine in the form of a suppository is used if disease is limited to the rectum. Foam and gel if disease extends to the sigmoid colon. Liquid enema if disease extends to the descending colon. Gel enema is better tolerated than foam enema, which is again better tolerated than liquid enema. Doctor will do blood tests, namely full blood count, liver and kidney function at 3 months and then once a year. It normally takes about 2 to 4 weeks for the drug to be effective. These drugs should be avoided if there's a history of allergy to aspirin. Mesalamine is well tolerated and it's a safe drug. The common side effects include nausea, headache, stomach pain, and diarrhea. Rare side effects include skin rash, bleeding, sore throat, fever, and rarely kidney and pancreas inflammation. Sulfasalazine can decrease sperm count, which is reversible once the drug is stopped. Mesalamine or 5-ASA does not suppress sperm count. Let's now look at steroids. Steroids can be in the form of enema, tablets or injections. Steroids are usually used in the initial period to get symptoms under control and are not recommended for long-term use because of side effects. 2 commonly used steroids which are given orally are Buddhisonite, which acts directly on the inflamed lining of the intestine. Budesonide is a form of steroid that is only released in the last part of the small intestine. It acts directly on the inflamed tissue in the intestine. It is also quickly inactivated by the liver and hence has fewer side effects compared to prednisolone. Budisonite is to be taken in the morning half an hour before breakfast. Prednisolone has to be absorbed into the body before it can reduce inflammation in the intestine. Unfortunately, it also suppresses the immune system elsewhere in the body. Rectal steroids in the form of suppository, foam or gel enema or liquid enema. Less is absorbed, so less side effects with rectal steroids. Take rectal steroids at night as you are likely to have more time and this will help you stay relaxed. Go to the toilet just before taking your rectal steroids. Try lying on the left side on a towel while inserting the applicator into your anus. Extra lubricant on the applicator might help. Stay lying on the left side or on the tummy for 20 to 30 minutes after to give the steroids time to work. After this time, you can go to the toilet to release the remaining liquid or foam. Side effects of long-term steroids include moon face, acne or pimples, increased body hair, increased body weight, diabetes mellitus, increased blood pressure, mood change, sleep problem, headache, giddiness, stomach pain, and osteoporosis or soft bones. Because of these side effects, steroids like prednisolone are not given for longer than 2 months and budesonide is not given for longer than 3 to 6 months.